Good afternoon. Good afternoon, Team QualiMed. Magandang hapon. Ayan, Miss Day, ang ating music. Magandang hapon, everybody. Thank you for being with us. If you have your teams with you, please tell them to sign in and log into the call to be with us in this session. So magandang hapon ulit and happy World Health Day to everybody. I hope nakita niyo yung video natin kanina na so I hope we have a healthy world and our yung ating contribution doon ay napakalaki din to make sure that our world continues to be healthy and hopefully gets healthier as we progress. So good afternoon, welcome to the second session of our Occupational Safety and Health webinar series. Session 2 is on drug-free, alcohol-free workplace. We are very happy to have with us today a representative from DOH to share with us his expertise. So again, let me introduce myself first. I am Bambi Picazo. I am your corporate training and OD manager of the QualiMed Health Network, and I will be emceeing this session this afternoon. And together with me, let me introduce our moderator for this afternoon, our very own doctor from QualiMed Hospital Center, Rosa. Ladies and gentlemen, Team QualiMed, let us call on Dr. Aaron Christian Villoso. Dr. Aaron? Dr. Aaron, I'm sorry, you're still on mute.
Sorry.
There you go.
Good afternoon.
It's okay.
So welcome to our second webinar under the Occupational and Safety Health Administration. For today, we are honored to have with us an expert on addiction medicine. Our speaker for today is currently the Chief of Hospital of DOH, Les Piñas, and currently also a member or fellow of the Philippine College of Addiction Medicine. Let us call on and let us welcome Dr. Jose Bienvenido Leabres. Good afternoon, sir.
Hi, good afternoon. Can I be heard?
Good afternoon. Yes, Doc. Good afternoon, Dr. Bien.
All right. First and foremost, thank you very much for QualiMed Health Network for inviting me to give a short orientation on substance abuse and its effects, and also probably the laws with regards to substance abuse. I was invited here by a very good friend, and I would like to thank her, Dr. Gina Nazareth, a very good friend and my classmate in med school, for inviting me over. So, maraming salamat. Also, I'd like to thank the President and CEO, Mr. Jimmy Ismail, and also our Vice President for Human Resources, Attorney Van Garcha, for giving me this opportunity. So, if I may, shall we proceed with the lecture already?
Dr. Yes, Aaron? Please, Doc.
All right. So, with the indulgence of everyone, may I share my slides? Okay, so again, good afternoon. For this afternoon, I'll give you a brief orientation on drug-free, alcohol-free workplace. So I will be discussing a few definitions of terms. I will discuss a little about how one becomes a drug addict, how one becomes addicted, and a few examples of drugs that cause addictions, some of the drugs that we abuse, and I will also discuss some significant parts of the law, Republic Act 9165 or the Dangerous Drugs Act, some significant parts that may be applicable, especially to us in the medical field. So with that, let's start first with how we define addictions. According to the American Society of Addiction Medicine, addiction is a treatable chronic medical disease. A few years ago, actually, when I was just starting as a young doctor in the field of addictions, addiction rehabilitation was under the care of the National Bureau of Investigation and the Philippine National Police. it was treated as a criminal offense. But with the advent of the development of science, it is now seen as a chronic medical disease. So I would like to emphasize to everybody, addiction is a medical disorder, and it is not necessarily a criminal disorder. So what happened was all the rehab centers of the National Bureau of Investigation and the Philippine National Police was transferred to the health sector, specifically the Department of Health. So from then on, from 1992, when the law on drugs came about, it is now considered as a medical disease. Now, addiction is a complex disease. It involves interactions between brain circuits, genetics, the environment, and life experiences. People generally have become compulsive and cannot control their drug use despite harmful consequences. I will explain that to you in a little while. Now, usually, prevention efforts and treatment approaches for addictions are generally successful, as similarly as those in other chronic diseases. So I hope it's clear with everybody that addiction in the Philippines is treated as a medical disease. And even our law on substance abuse and addiction is also involved with the medical aspect. Okay, so let me be clear with that. Now, what we're dealing with is drugs, right? But drugs is a very generic, is a very broad term. Paracetamol is a drug. Some antibiotics, they're all drugs because we administer them into our system to help us, to treat us, right? But to place us into context, we are talking about psychoactive drugs. So drugs, diba? So we are using psychoactive drugs, which are substances that when taken in affect the mental processes of an individual. So it can change your perception. For example, when you take some drugs, the taste of food will taste differently. There are some drugs that will make you see colors differently. It can change your consciousness. Sometimes you're very high, sometimes you're very depressed. It can change your cognition, you think differently, and it can change your mood and your emotions. Now, psychoactive drugs sila. And then we change it into psychoactive substances. Why is that so? Because we're not dealing with drugs anymore. There are some substances that can cause one to become an addict. A very good example would be our volatile solvents, rugby. It's not a drug, but now they're abusing it. So now the term changed from drugs to psychoactive drugs, and now we're using psychoactive substances. Okay. So a few statistics. This is the Philippine statistics from the World Health Organization in 2016. Among the drinkers, for a per capita of 100, for a per capita of 15 years old and above, the male drinkers would consume around 25 liters of alcoholic beverage in a year. So I know some of you drink. Most of you would not be achieving 25 liters. For males, no? But some of you will be drinking far more than 25 liters of alcoholic beverage a year. For females, 15 years and older, it's 9.1 liters. And for both sexes, they drink an average of 19.9, or that's roughly 20 liters of alcoholic beverage a year. Ang dami, no? For drugs naman, excuse me, the Dangerous Drugs Board came out with a national household survey on the patterns and trends of drug abuse way back in 2019. So they did a study on the Philippine population ages 10 to 65. Sorry, my slide has an error. This is for ages 10 to 69 years old. And they noted that for the lifetime user prevalence rate, there is 4.74 million out of the population of 81 million, 10 to 69 years. So they have tried dangerous drugs at least once in their life. So it means that 6 out of 100 Filipinos have tried dangerous drugs at least once in their life. So today there's, ilan ba tayo today? There's more than 50. We're close to 100 here today. So with that, no, 6 of you, if there's 100 here in our Zoom, and probably more, 6 of you have tried drugs at least once in your life. Now, for current users naman that are presently using, okay, this is a scientific study, ano, hindi to hula-hula ng ating mga politicians. So the study way back again in 2019 says that current users, there is 1.67 million Filipinos. So out of 81 million Filipinos, that means 2 out of 100 Filipinos are using drugs at this point in time. So for example, your hospital has around 300 population. So out of the 300 employees in your hospital, 6 out of those 300 would be currently using drugs. So actually, if you compare that to other countries, mas mababa tayo sa ngayon kaysa doon sa other countries. But still, it is a prevailing problem, right? So what are the impacts of alcohol and drug use in the workplace? The very number one manifestation would be absenteeism. Frequently, maraming nag-absent. There are a lot of them that would fail to report on time. Tardiness would be very, very frequent, right? So absenteeism. Second one would be accidents. Accidents happen in any organization, even hospitals. And especially in hospitals, we do not want accidents to happen. We do not want surgical instruments left behind, operative sponges left behind. We don't want our patients that are being wheeled to fall over. So these are accidents can happen because of alcohol and drug use in the workplace. The third most common impact of alcohol and drug use in the workplace is turnover. They don't last long. They would go from one job to another, from one job to another. And that's sayang because we're training all these people. They train, they develop experience. And with that, every time there's a turnover, it gives somebody else somebody else that is supposed to be qualified the opportunity sana na mabigyan sila ng appropriate training and work for the facility. But then if there's substance abuse or alcohol abuse in the workplace, then people tend to there would be a job turnaround, quicker job turnaround, and sayang naman yung investments natin sa ating mga employees. The fourth major impact would be job satisfaction. They are never satisfied. And of course, when you're working with a drug dependent and they are having some behavioral issues, of course, it affects the whole team. And finally, there are other things like theft, vandalism, bad behavior. May mga nagwawala dyan, may nagagalit sa mga boss nila, mapagalitan lang ng konti. So these are the other things that have an impact on the workplace because of alcohol and substance abuse. Okay, so now let's deal with how one becomes a drug dependent. Okay, if we look at the brain, there's something called the dopamine theory of addiction. Okay, it has something to do with our mesolimbic pathway or a dopamine reward pathway. The mesolimbic pathway is a tract of nerves or neurons that extend from the brain, from the ventral tegmental area to the nucleus accumbens to the prefrontal cortex. Why is this important? In normal times, when something positive, something good happens to us, the mesolimbic pathway or a dopamine reward pathway gets activated. So for example, you won the lottery, the dopamine reward pathway or the mesolimbic pathway will get activated. For example, you graduated with honors, this pathway will be activated. And what happens when this gets activated? This pathway will now release dopamine, which is a neurotransmitter responsible for giving us positive sensations, positive emotions. So it will release dopamine. Mind you, there are many chemicals in the brain. There are many chemicals called neurotransmitters in the brain. But specific for addiction would be the dopamine neurotransmitter. And with the mesolimbic pathway, you release dopamine during positive things that are happening in your life. So your girlfriend says yes to you, then you release dopamine in your dopamine reward pathway. So what happens? Okay, we look at the synapse or the connection between one nerve cell to the other in the dopamine reward pathway or in the mesolimbic pathway. So what we see here now in our slide is a an illustration of a synapse, or the connection between one neuron to the next one nerve cell to the next nerve cell in the brain within the mesolimbic pathway. So if you look at the photograph on the left, normally we would have dopamine within these neurons, within the synapse. Okay, when something positive happens, these neurons are released in between the two nerve cells, the synapse, and they will attach to a dopamine receptor. So this happens all over your dopamine pathway. So if something makes you feel good, the dopamine gets released, it attaches to the pathway, and it makes you feel good. And then some of it gets degraded, and some of it gets reabsorbed back into the synapse, into the into the nerve cell. Now, what does a drug do? A drug, for example, if we look at the illustration on the right, excuse me, if you look at the illustration on the right, what cocaine, an example is cocaine. What cocaine will do is it will release the dopamine, and at the same time, it will block the reuptake of dopamine back into the cells. So the dopamine stays in the neural cleft, in the synapse, for a longer period of time, giving you the feeling, making you feel good for a longer period of time, and sometimes even higher because it will release more dopamine. Methamphetamine will also do something similar. Methamphetamine will interact with the receptors, connecting to the receptors, and it will last longer. It makes you feel good. So also it will happen with alcohol, nicotine, caffeine, and other drugs. So after a while, when this gets stimulated and stimulated, there is something called neuroadaptation. Your nerves will adapt. Since there is artificial stimulation of the neurons, then it will produce less dopamine, and the receptors, the dopamine receptors, will be less reactive. So what will it do? It will now tell your body that you need more dopamine, and your unconscious or your subconscious will now tell you you need an external source of dopamine. So you need to find drugs to maintain a certain level of dopamine. So unconsciously, the drug dependent will now think na I need to feel good because I need more dopamine in my system. And so I will now look for drugs. And the cycle will repeat in itself. Now, going to that cycle, an addiction cycle was described by Kub and Lemoine in 2008. What happens when there's neuroadaptation already, when you're addicted to the drug already? It goes through a certain cycle. First, you take the drug, you binge, so you become intoxicated, you feel good. And then after a while, the drug wears off. So you will go into withdrawal. And after withdrawal, and when you're good, when you're when you're having your withdrawal symptoms, you would feel bad. I don't know if some of you have already experienced having hangovers when you drink, when you come from an alcoholic binge after you mag-inom. You go into the withdrawal, you feel bad. So what do? Sometimes you take drugs or alcohol again. So you binge first and become intoxicated. You withdraw, you would have negative or bad feelings, and then you start getting preoccupied and anticipate. You will start looking for your drugs again, and then you find your drugs, you take your drugs, and then you withdraw, and then you look for the drugs again, and the cycle goes on and on and on into a downward spiral. Now, as you take more and more drugs, the cycle shortens and shortens and shortens. If previously it takes you 1 week before you look for your drugs, it will now become 5 days, and then eventually 3 days, and then eventually you just need your drugs just to feel normal. It doesn't give you the high anymore. So it goes into a cycle, but more or less it goes into a downward spiral. So that is how the addiction cycle occurs in an individual. Now let's move on already. I hope I'm not going too fast. Am I?
No, sir.
Okay. So,
It's good, Doc.
okay lang, ano? Okay, so we've discussed about some definitions, how the drugs affect our neurons and the mesolimbic pathway and the addiction cycle. So let's talk about some common substances of abuse. Okay, there are so many, but I will just discuss some of the substances that are very common to all of us, especially to us in the medical field. Okay, the first one would be alcohol. I'm sure all of you have seen somebody who's taken alcohol and get drunk. They have difficulty in focusing. Actually, at the beginning, it's more of a stimulant, ano? But after a while, it's really actually a depressant. First, they become very talkative because of the reduced inhibitions. But then again, after a while, they just become depressed and quiet, and then they fall asleep. Some they go into coma, and bad things happen. Okay. When you're drinking alcohol, your focusing is different. You're a lot less focused on how you do things. You feel relaxed and diminished and stressed ninyo at first. But of course, it doesn't occur every time. And then, as I said a while ago, reduced ang inhibitions ninyo. So dati-dati, if you're talking to your boss, nahihiya ka pa, you're shy to talk to your boss, and you're taking alcohol, you can talk to them about anything under the sun. You can even ask for a raise or something like that. They have memory loss. It affects vision, coordination, and reflexes. Now, this common effect, no? Actually, alcohol is the most abused substance in the world, and even in the Philippines, because it's legal. So it's easily, everybody can just get it from any sari-sari store. Anybody can get it from any grocery store because it's legal. But this is actually the most abused drug in the world and even in our country. So I don't have the statistics here with me, but there's US statistics that 1 out of 10 doctors have problems with alcohol or drugs, and 2 out of 10 nurses have problems with alcohol and drugs. So medyo mataas tayo, di ba? Well, more or less. The medical field is there also. We're not immune to substance abuse. So that would be the effect of alcohol. The alcohol affects the dopamine and also gamma aminobutyric acid. So it makes you depressed. The second substance of abuse, excuse me, the second substance abuse is cannabis. Marijuana, jutes, chonky. This has been there since for a very long time already, right? So cannabis sativa is the plant. It's usually, in our country, it's usually dried and smoked. But in other countries, they make it into oil. There are some people here that make it into oil. They add it to salads. It's been legalized in a lot of countries already, but not in the Philippines. It can be an oil, it can be a wax, it can be, they put it into brownies. They put it into brownies, also known as space cakes. But more often than not, it is smoked right now. Current statistics natin ng Philippine Drug Enforcement Agency, there has been a shift from previously, it has been shabu, which was the number one drugs that they're catching. Now, it's now cannabis. So dumadami ang cannabis use or mababa ng methamphetamine na huli nila. So cannabis is primarily a hallucinogen. You would see them having food trips. Food tastes very good for some of them. They would have laughing trips. You would notice them to have very red eyes, increased ang sociability nila. But you would notice some behavioral effects. To name a few, increased alertness. Some of them are depressed, meaning slowed down. I'm not saying depressed mood, no? Slowed down, decreased anxiety. They have vivid color perceptions, distorted spatial perceptions, slow reaction time, short-term memory loss, and psychomotor impairment. Now, siguro this is one of the most controversial ones kasi right now there's medical marijuana. The Philippines is now studying the possibility of medical marijuana in its pharmaceutical form, hindi po in its raw form. Some countries are using it in its raw form, either it's in the form of oil or, well, hopefully not smoking. But we're looking at cannabis here. which the active ingredient is, there are two major active ingredients that are significant for us. The one is tetrahydrocannabinol, which causes the high, and the other one is cannabidiol. And the Philippine government now is looking at the possibility of the pharmaceutical grade of cannabidiol to be imported in the Philippines, and hopefully may be part of the our pharmacopoeia if it can help us. So we're looking at that already. But as of the moment, no, I would like to remind everybody, cannabidiol, tetrahydrocannabinol, and marijuana in its in any other form is still illegal in the country. The only way you can import cannabidiol is if you request from the FDA for a compassionate permit, and that compassionate permit has to be approved by the Dangerous Drugs Board and the Philippine Drug Enforcement Agency for you to be able to bring cannabis in the country for medical purposes. But that's going to go through a lot muna. Okay, so hopefully more studies will come out, more positive studies will come out, and let's see if cannabidiol would be helpful for our country. Okay, the next substance of abuse is methamphetamine, amphetamines, and shabu. Okay, street name shabu. In other countries, other Southeast Asian countries, they call it yaba. The main way that we're taking shabu here, or methamphetamine here in the Philippines, is through smoking. If you look at the photograph on the right, they have a tin foil, and then they would line up the shabu crystals on top of that tin foil. They would roll another tin foil, and then they would light up the bottom. Usually you would see a lighter that they have removed the cover of the lighter, and they would heat that up, and now they would follow the smoke and inhale that smoke. Methamphetamine, amphetamines, and also including ecstasy or 3,5-dimethyl methamphetamine would have behavioral effects. This is a stimulant, also known as poor man's cocaine, shabu, shabs, and other names that they use for it. So what does it do? Speeds up. It's a speed. So they have intense euphoria, lagi silang tama, they have delusions of grandeur, their ideas fly from one idea to another, sexually stimulated, ang kulit-kulit nila, high energy. Tapos nagtitrip sila, obsessive compulsive activity. They have very disorganized thoughts. Some of them have paranoia, and some of them can become violent, irritable and violent, and they have auditory and tactile hallucinations. Mind you, all drugs can cause hallucinations, can be visual, tactile, auditory. It can be that, and it can be delusional. So you would see most of them, they would start, because they're primarily stimulated, their metabolism is very high, tendency to lose weight. Makikita mo, ang dry ng skin nila. You would see the fats in their faces, medyo nawawala na. And then something different with them is you would see them with something called meth mouth. The enamel of their teeth would be sira-sira already because of the acidic nature of the methamphetamine. They smoke it, so nasisira ang teeth nila. They would have a tendency to have meth mouth or dental caries, cavities among their with their mouth. Okay, so this is one of the primary problems we have in the Philippines. We also have another stimulant, which is cocaine, but it's not so much available here in the country, and it's quite expensive. So the poor man's cocaine is readily available here in the country. Okay, so another substance of abuse, substance ha, kasi hindi siya drug, are volatile solvents. I don't know if some of you would see them sa street children in Manila. They would have their hands inside their shirts, and they have a plastic bag, and they would be inhaling that plastic bag. That's rugby. Ang active ingredient would be toluene. So toluene would have, of course, dizziness, would cause them euphoria, grandiosity. Some of them would be very, very drowsy. You would see them sleeping on the streets, slow reaction time. According to these kids, they take it to forget their hunger pangs. But actually, they're being drugged by the syndicates. Tinuturuan sila mag-rugby. So they would be begging, and then they would take the rugby as in exchange. in exchange for that. So of course, it's not very good for the health. And there's something called um, sudden sniffing death syndrome, SSDS. Sometimes they would just undergo respiratory depression during their high. They would fall asleep and then they would have respiratory depression and they would no longer wake up. So it happens to a lot of street children. So they should be rescued, no? Kawawa naman sila. If you're gonna give them something, don't give them money. Give them something to eat, a biscuit perhaps, or some form of food for them to eat, but never give them money. So you would see volatile solvents mostly with kids, with children, street children, but there are some adults. I've seen some adults also take volatile solvents. So rugby is the number one drug that they use, substance that they use. So again, dizziness, euphoria, grandiosity, slow reaction time, distorted perception, weakness, memory loss, hallucinations. Also, you would see them, marami silang parang residue sa face kasi dumidikit-dikit yung rugby, hindi nila natatanggal. So that's something that you would notice with them. Now, moving on to another substance of abuse is one of the most common siguro na drugs in the medical field. Why? It is easily accessible. So there's two of them, yung most common sa nakikita sa medical field. First one is opioids. For example, morphine. Morphine is an artificial opioids. Opioids come from opium, of course. So from opium, they can make it into morphine, and the more dangerous ones are heroin, and also you have fentanyl, among the many different kinds of opioids. What does it do? It's supposed to relieve pain, but at the same time, it also sedates. It causes dizziness, nausea and vomiting, constipation, tolerance, and worst of all, respiratory depression. So this is one of the most common ones you would see that's being abused by the health professionals because it's readily available. So how do you notice that health professionals are, no? So sometimes most of them would prefer the nighttime. They would prefer assignments that have access to these medications. They would prefer that they would be the ones administering that medications to the patients, but they're not actually administering it and they're keeping it to themselves. So parang litong-lito yung na hindi nabibigay yung mga gamot. So those are some common signs that a health professional is probably taking drugs. Also, opioids tend to be injected, so you would see needle marks all over their arms. The second type of substance that is common are the commonly used by the health professionals are benzodiazepines. So you have your Valium, diazepam, clonazepam, or equispinoy, lorazepam, Ativan, which are all, of course, depressants. So it will cause drowsiness and sleep, mental confusion, short-term memory loss, lack of motor control, blurred vision, etc., etc., etc. Benzos, can also cause respiratory depression and death if they overdose on it. Okay, so there are many more substances, but I think these are the ones that we commonly see in our profession. Okay, so some of them you will see. I know some of you may have a family member or some of you may have a friend who has problems with drugs. So these are the ones that are most commonly seen in the profession and also on the streets. There are others, but I don't think it would be probably for another time, a lecture for another time. Okay. So how do we know if one is already an addict or, according to the psychiatrist, somebody with substance use disorder? So the American Psychiatric Association came up with a diagnostic and statistic manual for mental disorders, and part of that are the criteria for substance use disorders. So kung may substance use disorder na ang isang tao, an individual, will have substance use disorder, there is a criteria that the DSM-5 recommends. First criteria is, of course, there should be a problematic pattern of substance use leading to clinically significant impairment or distress manifested by at least two of the following symptoms that I will show later occurring within a 12-month period. So, keywords: pattern of substance use, clinical significant impairment or distress, with two or more of the following symptoms that I will show later within a 12-month period. So kunwari, bagong user pa lang siya, it's not yet a disorder. Some of them would just be a user. But of course, you have to address that already. Kasi you have to nip it in the bud already. You have to address, you have to prevent substance use. And if they're starting already, as early as possible, early intervention should be done. Okay? So, they're using drugs, there's impairment, it has been going on for at least 12-month period. So these are all divided into 4 areas. So the first area out of the symptoms is impaired control. So impaired control, there's 4 of them. The first one is a substance is often taken in larger amounts or over a longer period of time that was intended. So a drug user planned to take it, but he has failed to control it, and he has taken it larger amounts or for a longer period than what he really planned to do. Siguro sasabihin niya, titikim lang ako. Pero yung tikim na yun, nagtuloy-tuloy na. From tikim, naging occasional use, naging regular use, and then eventually compulsive use. The second criteria would be a persistent desire or unsuccessful efforts to cut down or control substance use. So, it says everything, right? Hindi na nila makontrol, hindi na nila ma-cut down. The third criteria is they spend a great deal of time in activities necessary to obtain a substance or use a substance or recover from its effects. So what example? Wala siyang mabili na drugs dun sa area niya. So this individual would now go to even 2 or 3 towns or 3 cities away to another pusher just so they could buy their drugs. Or they would go, whenever they take a drug, it takes long for them to...
I don't understand.
To take them a longer time for them to recover from its effects. The fourth criteria, which is part of the first group ng impaired control, is they have a craving or a strong desire or urge to use a substance. Ginigiyang ang term nila. Talagang hinahanap-hanap nila yung drugs. Pag nawalan sila ng drugs, nawala ng effect, they will start looking for it. Remember when I was showing you the addiction cycle? There's a shorter period already from the time that they start withdrawing to the time that they take a drug already. Okay, so that's the first group of criteria. The second set of criteria is there's already social impairment. So 5th, 6th, and 7th criteria. So the 5th criteria is recurrent substance use and a failure to fulfill major roles, obligations at work, at school, or at home. So in the office, frequently absent. They are not submitting their accomplishments on time. They cannot finish anything at all. At work, at school, at home, napapabayaan na nila yung pamilya. Instead of using their money for needs of the family, they're using their money to buy drugs. They don't attend activities of the family parties, family gatherings, birthdays, among many others. Okay, the 6th criteria is they're having problems already, continued substance use despite having persistent or recurrent social or interpersonal problems caused or exacerbated by the effects of a substance. So lagi na silang nag-aaway ng wife niya, tuwing nag-withdrawal siya, tuwing high siya, ang kulit-kulit niya, nakukulitan si family, tuwing nag-withdrawal, ang init-init ng ulo, nakikipag-away sa family, konting bagay lang, they're having fights in the family already. And despite that, it is pointed out that it's caused by the drugs, they still persist to use the drugs. So that's criteria number 6. Criteria number 7 is that Important social, occupational, or recreational activities are given up or reduced because of substance abuse. They are not doing their social activities. They don't attend parties. They don't attend their meetings in the offices. They don't do any recreation. Kung dati, they go biking or they go badminton or they go swimming to the beach. They don't like doing that anymore. They'd avoid that because they want to use drugs instead. They would just rather go hang out with the people taking drugs with them or on their own in hiding use their drugs. So ayaw na nilang sumama sa kanilang mga activities or umattend ng mga activities. So you would also notice that among alcoholics, ano? So in the office, you would notice that they're not accomplishing anything. They were not attending the meetings already. Pag nagpapatawag, if there's an office social activity, they're not attending it anymore. They come up with all the excuses in the world not to attend. Okay, so next would be risky use. So they use drugs in situations where it's physically hazardous. Some of them, no, I know some people na medyo may kaya, rich kids, they'd go to the squatters area to use there just because they want to use. They don't care whether they get held up, they get snatched, yung gamit nila, mapickpocket sila, or maybe mapaaway sila, but they would go into those hazardous situations just so they could take drugs. Okay. And the 10th one would be they would use the substance despite knowing that there's a physical or psychological problem that was caused by it or exacerbated by the drugs. Alam nilang apektado na yung katawan nila, payat na sila. Alam nilang they're hypertensive already because of the drugs. Alam nilang inaatake na sila sa puso because of the drugs. But they continue to do that. They're having hallucinations already. They know it's because of the drugs. And yet they continue to use the drugs. So those are risky use of drugs. And finally, two things, tolerance and withdrawal. Tolerance and withdrawal, of course, with most of the drugs, not just substances of abuse, there's tolerance and withdrawal. Tolerance means you need higher doses to have the desired effect. So sa drugs, sa pag-abuso ng drugs, they need a higher dose for a longer period of time because the drugs that they used before in the beginning has no effect already. Let's compare it with alcohol. Ano? In the beginning, when you're a new alcohol drinker, one bottle of beer or maybe half a bottle of beer, you get drunk already. But as the days pass, as the months pass, as the years pass, one bottle becomes two bottles, you're okay. 3 bottles now, 4 bottles, 5 bottles of beer, you're still okay. On the 6th bottle, saka mo lang siya na-feel na tumatama sa'yo. Then that's the time you feel that you're having an effect on you. So it means that you have a higher tolerance for alcohol. Same with drugs. The first time, one hit, it gives you a high. Next time, nothing gives you a high anymore. So you have developed a tolerance for that substance. The last one would be withdrawal. After you take the drugs, neuroadaptation has set in. You don't have enough dopamine and other neurotransmitters that support your body anymore. So you would feel bad. You feel low, you feel slow, you feel depressed because you don't have enough dopamine anymore. Right? You're just like having a hangover. So on tendencies, you subconsciously or unconsciously look for the drugs. You're in withdrawal. So nagkaroon na ng neuroadaptation. With all of that, no, I think that's that with all of those criteria, you now have to count which one falls within your patient. Okay, so those criteria, when you're having substance abuse, this is now divided into its severity based on the number of criteria that was shown to you a while ago. If you have 2 or 3 of the criteria, you're considered as you having a mild substance use disorder. 4 to 5 means you have moderate substance use disorder, and severe, 6 or more, of course, it's severe already, severe substance use disorder. This is important for the treatment of our patients. Not all drug users are sent into a drug rehabilitation center, into a residential or an inpatient drug rehab center. We can do them for mild and moderate. This too can be done on an outpatient program or an individual program with an addiction medicine specialist or a psychiatrist. For moderate and severe, there's a possibility. Of course, some moderates may be admitted into a residential rehab. And of course, when it's severe, you have to be admitted in a rehab center already. Okay. So much for the criteria for substance use disorders. I hope that you more or less have an idea on how to classify a substance use disorders based on its severity. I will be giving you a copy of my slides through our secretariat here, so that if you need a copy, just ask from them. Okay. Moving on, we move on to urine drug testing. Okay. I'm sure all of you, before you got in one way or another, has underwent urine drug testing already. Actually, it's completely consists of 2 steps, and you can test for different types of body fluids. You can use, of course, the most common one we use is urine, but you can also use blood. You can use hair. You can use sweat. You can use some of the tissues, especially sa autopsies, among all of that, and also lately saliva. So it's actually 2 steps. The first one is a urine drug screen. It is merely a screening test, and it shows whether it's positive or negative for a certain type of drug. The most common drug screens that we use here is for methamphetamine and cannabis, but some urine drug screens that are used in private hospitals can include also cocaine, can also include ecstasy. It can also include opioids. So alcohol, it's usually a breathalyzer test, but pero sa drugs, it's usually drug screening. Of course, before you undergo drug screening, unless it is mandated by law, nahuli kayo or whatnot, you need to give your consent. And then after the consent, you will take 60 ml of the urine. And then with that 60 ml, right there and then, usually sa drug testing area, they would use a urine drug screen. It's an immunoassay screen, very much similar to what is used sa pregnancy test. A few drops of urine, and it will tell you whether it's positive for a drug test, for drugs or not, for that specific drug or not. Now, if it's negative, the drug testing ends there. You're declared already as negative. If it's positive, it does not stop there. The specimen, properly sealed, properly labeled, should be frozen and transported properly to a confirmatory testing center. Sa confirmatory testing center, this one will test specifically what type of drug it is, how much drug is there in that urine sample. The machine that they use is either a gas or a liquid chromatograph and mass spectrophotometer. So specific to, actually they use it for other chemicals, but primarily here we use it for drugs, but you can use it for other chemicals such as yung mga bombs. Pwede nilang gamitin yan. Now, a confirmatory test, if it's positive, positive talaga yon. It's difficult to contest that. But should you wish to contest that, you only have 15 days to contest that. So using the same sample that was taken from you previously, hindi yung bagong sample na uli, no? The sample that was taken to you during your initial test will be undergo retesting again. And that retesting, if it is positive again, then hindi na pwedeng iulit-ulit. And then you will have to suffer whatever consequences it be, whether it be treatment or whether it should be, some form of legal implication. Okay, so those are the 2 steps you undergo when you drug test. I'm sure that your office is mandated to do drug testing. It is mandated by law to do drug testing on your employees on a regular basis, random drug testing on on the employees on a regular basis. And usually that's also part of the requirement for entry or for hiring a drug screen. Now, here's the thing, no? A drug test will only say whether that person took the drugs at that point in time. So syempre, when the drugs wear off, the drugs will not be detected anymore. After a certain period of time, the drugs will not be detected anymore. And if you test that outside of that window period, it will come out negative. So, tsempuhan yan. Kailan mo kukuhanin yung drug test? For the clinicians that would do drug testing on patients for treatment purposes, timing is essential. You have to do your medical examination to determine whether this is the right time to test the patient or not, whether the patient is in withdrawal or is intoxicated, or he's doing okay. So timing would be essential for the clinician for treatment purposes. Okay. So next would be drug abuse treatment and rehabilitation. So there are actually 4 steps for drug abuse treatment and rehabilitation, similarly with alcohol treatment and rehabilitation. The first one would be a medical examination. Sa drugs, no, not sa alcohol, no. Sa drugs, we call it a drug dependence examination or the DDE. This is very much like any other medical examination, but it is more focused on drugs. You will take a drug history of the patient. You will take, of course, the social history, the drug taking history of the patient. You will look for the symptoms of the patient, the review of systems. You will do a physical examination to determine whether the patient is intoxicated or not. You will have to determine whether there are complications related to drug use, such as coronary artery diseases, liver problems, especially for alcoholics, lung problems for those addicted to nicotine, among many others. So you do your physical examination, you do your mental status examination so that you could see whether the patient has psychiatric effects already, such as hallucinations, delusions, depression, suicidal ideations, among many others. And you also have to do your neurologic examination, so to rule out other mental, whether it has had an effect on your nervous system. Some of them would have microstroke, some of them would have those problems already. And then you have to rule out whether the examination, whether it is a psychiatric, a drug problem, or a neurologic problem. And you have to deal with the medical problems that ensue with it. So if there are medical problems, if there are psychiatric problems, co-manage. Okay. So after you do the drug dependency examination, you now put the patient on detoxification or on withdrawal management, depending on the status of the patient. Detoxification means the removal of the drugs from the system of the person, while withdrawal management is to help the patient during the withdrawal phases. So those are the second phase. Usually and ideally, it's in a hospital setting. Okay. The third would be drug treatment and rehabilitation already. So depending on the severity, wag man immediately nag-eksperimento lang sa drugs. And it has happened a lot to some parents that their children have experimented on drugs. They would want to put them inside a residential or an inpatient rehab. No. You have to determine the severity of drug use and put them first on either individual counseling or an outpatient rehabilitation program, depending on the severity. What happens? They undergo counseling, they undergo behavior shaping tools, they undergo peer groups, among many others. So that's what happens both in the outpatient and on the inpatient. If they are severe, then they need to undergo residential rehabilitation programs. Ito na yung mga drug rehabilitation programs. Statistically, between 1 to 2% would only need inpatient rehab programs. 4 to 5% would need an outpatient programs, and majority nakukuha na natin sa community-based programs or individual counseling. So, wag naman agad-agad iparehab. Ipa-assess nyo ng mabuti. And then, pag na-assess ng mabuti, start first with counseling. Very traumatic ang nakakonfine sa rehabilitation center. Ang hirap para sa isang tao. The world stops for them at the time that they're in rehabilitation. So, we reserve that for those severe cases. Let's start with individual counseling first and see where it goes from there. If it doesn't work, then we step up to an outpatient program. This is a more structured program. They have to report regularly, once to twice a week, to a program, but their life continues. They still go back to school. They go back to work during that period. And kung hindi na talaga kaya, then kung talagang severe sila, they go into a residential rehabilitation program. The law says the patient should undergo 6 to 12 months of rehabilitation. But in my experience, it can be very short as 3 months for those mild cases, and it can be longer than 2 years for some that are in rehabilitation. But we stop usually at 12 months. Finally, when they're finished with their treatment and rehabilitation program, there must be an aftercare and follow-up program. They are continued how well they are adjusting at their homes, how well they are adjusting at work or at school. So dapat pina-follow up pa rin sila. It is not as, from time to time they will have problems, and these problems can be addressed during the aftercare and follow-up program to prevent them from relapsing and to teach them the ideal ways of dealing with those problems. So those are generally the 4 steps that they undergo in a treatment and rehabilitation program. So much for that. That's more or less on the clinical side. If I may continue, siguro, kasi we're running short of time. I would like to discuss the law on dangerous drugs, or the Comprehensive Dangerous Drugs Act of 2002. We don't have a law on alcohol, except that there's a law that puts a higher tax on alcoholic beverages, and also the drunk and driving law. But to stop alcoholism, wala pa tayo, and I hope they come up with something already. Okay. For the Comprehensive Dangerous Drugs Act of 2002, or RA 9165, I only selected a few sections that I believe would be significant for all of us, especially here in the medical field. The first one is, of course, Section 2, a declaration of policy. The third paragraph of Section 2 of RA 9165 states that it is declared the policy of the state to provide effective mechanisms or measures to integrate into society individuals who have fallen victims to drug abuse or dangerous drug dependence through sustainable programs of treatment and rehabilitation. What does this third paragraph, Section 2, Paragraph 3 of Declaration of Policy of 9165 say? That drug abuse and drug dependence should undergo programs of treatment and rehabilitation. Dati-rate, with the previous law, which is RA 6425, way back in 1972, it was PNP and NBI. But with 9165, it is now the Department of Health, meaning it is a health problem as seen all over the country, hopefully. But the law states that it is a program for health, which is a program for treatment and rehabilitation. Now, I will go through several sections. Having that cleared, now I will go through several sections that may be important to all of us. Okay, these are the different sections that are important, that may be important to all of us here. The first one is Section 5, Article 2 of which is unlawful acts and penalties. Section 5, Article 2, Section 5 is sale, trading, administration, dispensation, delivery, distribution, and transportation of dangerous drugs. There has been some cases wherein some health professionals have been caught in the sale, in the administration of dangerous drugs. Meron na po yan. Merong doktor na nahuli na nagbebenta at nag-administer ng shabu, injectable. Merong nursing attendant na nagbebenta ng shabu within hospital premises. Nahuli din po ng PIDEA iyon. So, this is one very important one. And this section, ang penalty for that section is life imprisonment to death and a fine of, if I'm not mistaken, it's 500,000 to 10 million pesos on top of life imprisonment to death. So sale, administration, dispensation. The second section is the possession of dangerous drugs. If you possess dangerous drugs in certain quantities, like for example, if you possess 50 grams or more of shabu, 10 grams or more of cocaine, half a kilo of marijuana, 10 grams of ecstasy, or 10 grams of morphine, etc., 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 the penalty for possession of those drugs is the fine of 500,000 to 10 million, parang sale ka na rin, and life imprisonment to death. Actually, wala naman tayong death penalty sa ngayon. So this is life imprisonment. The third section is possession of equipment and other paraphernalia. So this is possession of equipment, instrument, apparatus, and other paraphernalia of dangerous drugs. For example, nakita niyo yung kanina, yung sa shabu, yung tin foil, that is considered a paraphernalia already. Naka-fall siya in that manner. Or paraphernalia siya yung ni-roll na tin foil, paraphernalia. There are some na may high-tech, medyo high-tech sila. They have glass tutors, social sila. They have water na based na tutors among many others, among all of that. Yung iba parang sishang design pero made out of glass. So those are paraphernalia. And if you possess equipment, instruments, apparatus, or other paraphernalia for dangerous drugs, the penalty is imprisonment of 6 months and 1 day to 4 years and a fine of 10,000 to 50,000 pesos. So 5 and 11, 500,000 to 10 million, life imprisonment to death. 12 is 6 months and 1 day to 4 years and 10,000 pesos to 50,000 pesos. Okay. Section 13 is possession of dangerous drugs during parties and social gatherings or meetings. Parties and social gatherings or meetings is 2 or more individuals. So if 2 or more yan and possession, Section 11 applies. So ano ba yung Section 11? Section 11 is possession of a certain amount of drugs, but it has a penalty if it's more than that, more than a certain amount, life imprisonment to death or a fine of 500 to 10 million. Now, if less than that, of course, there's an adjustment to that. Okay. Finally, Section 15 for the use of dangerous drugs. If you are apprehended using dangerous drugs and test positive ka for dangerous drugs, for the first time na mahuhuli ka, you are sent to a government rehabilitation center for a period of no less than 6 months or until sabihin sa ng accredited physician mo, ng DOH accredited physician for dangerous drugs, that you are rehabilitated for the use. For the second, na mahuli ka and you tested positive for dangerous drugs, second time, no? It's an imprisonment of 6 years and 1 day to 12 years and a fine of 50,000 to 200,000. Provided that the quantity of dangerous drugs na nahuli sa inyo does not fall under Section 11, possession of dangerous drugs. So dagdag pa yon, madadagdagan ng madadagdagan. Okay? So those are the unlawful acts when you're using, trading, possession of dangerous drugs. Now, moving on naman, prescriptions. So Section 18 is unnecessary prescription of dangerous drugs. So if you have unnecessary prescription of dangerous drugs, okay. Hold on, no? Sino ba ang mga unnecessary prescription of dangerous drugs? The unnecessary prescription of dangerous drugs are those that are qualified to prescribe drugs, dangerous drugs. Yung mga may S2 licenses. Okay, sino ba sila? Doctors, veterinarians, dentists, or other doctors, no? Even if without an S2, that would prescribe dangerous drugs, no? To any person whose physical or psychological condition does not require the use of the drug or in a dose prescribed therein that is higher than what is required, then
Magkano yung 2.5, no?
So the penalty would be 12 years and 1 day to 20 years and a fine ranging from 100,000 pesos to 500,000 pesos. So if there are doctors here, no, be careful with prescribing dangerous drugs to your person, especially yung mga drug users na nagsha-shopping ng doktor para lang ma-prescribean sila ng drugs. Happens to me a lot, and I know it happens a lot to mga psychiatrists. We have to be very careful, okay? So don't prescribe unless it's needed, and prescribe within the therapeutic limits only. And don't prescribe a lot. So i-limit mo lang siya para lagi nagpa-follow up sa'yo na mo-monitor mo yung pasyente kung nagiging addicted na siya sa drugs o hindi. Now, Section 19 is unlawful prescription of dangerous drugs. Section 18 is unnecessary, no? Section 19 is unlawful prescription. So these are for people that are not qualified to make any prescription, but they falsify a prescription for dangerous drugs. It doesn't matter kung nagamit yan o hindi. Basta nag-prescribe ka unlawfully, gumawa ka ng prescription for dangerous drugs, nameke ka ng prescription for dangerous drugs, then it comes with a penalty of life imprisonment to death and a fine ranging from 500,000 to 10 million pesos. Okay? So Section 18, para sa mga health professionals, unnecessary prescription, 12 years and 1 day to 20 years and 100,000 to 500,000. Para dun sa unlawful, Section 19, unlawful, life imprisonment to death and a fine from 500,000 to 10 million for that prescription. Okay? So I hope that you were able to absorb all of that. For further reading, you can go through Republic Act 9165 and check on that, the law mismo and its implementing rules and regulations. All right? So let's put it in, let's put it as a sample case. Huh? Okay. So, sample case natin, ano? A nursing attendant steals a prescription pad from the hospital and prescribes morphine. He purchased 10 grams of morphine and then sells it. However, during the sale, he was apprehended in a buy-bust operation. So upon apprehension, a fake prescription was found and he was noted to have unusual behavior. He was tested for dangerous drugs and was found to be positive for methamphetamine. So what are the sections of RA 9165 that are applicable in his case? Okay. So ano ba yung nangyari sa kanya? Nagnakaw siya. Pero theft is not part of 9165, ha? So nagnakaw siya. Nagnakaw siya ng prescription and then nag-prescribe siya ng dangerous drugs. Siguro nangopya siya from one of the doctors there. Alam niyo naman sa hospital, maraming nakakalat na prescription and sometimes nakikita nila, they help fulfill the prescription, they can easily falsify it. Pwede nilang i-fake pa, pati signature ng doktor. Okay, so unlawful prescription siya, Section 19. Unlawful prescription of dangerous drugs. What happens next? He bought the drugs and he sold the drugs. So ano yun? Section 5, sale of dangerous drugs. So pangalawang kaso na niya yun, no? So unlawful prescription, sale of dangerous drugs. Now, unusual yung behavior niya. So na-drug test siya, positive for methamphetamine. So ano nangyari? Section 15, use of dangerous drugs. So bakit use of dangerous drugs lang, hindi Section 11, possession? Well, kanina pala possession of dangerous drugs. Use of dangerous drugs din. Kasi methamphetamine yung positive sa kanya, hindi yung dala-dala niyang drugs, which was morphine, right? So, ito yon. Article 11, Section 19, unlawful prescription, life imprisonment to death and fine of 500,000 to 1 million. Now, the second one is Section 5, sale of dangerous drugs, life imprisonment to death, 500K to 10 million. Sorry, I think I made a mistake here. It's 10 million, no? 500,000 to 10 million for Article Section 19 and Section 5. And finally, no, Section 15, kung first time yung marirehab, it's 6 months in a government rehab center for the first offense, or it can be longer for the second offense is already he has to be incarcerated already with a fine. Okay, so I hope you were able to understand at least some of the cases, some of the specific articles of Republic Act 9165. So with that, I end this lecture. Maraming salamat po. I hope you were able to understand a little more about substance abuse. Hopefully, we can go into more detail, but if you need to, you can get in touch with me through email, jbliabresmd@doh.gov.ph, or through your secretariat. I will leave a copy po of this presentation with the secretariat. So maraming salamat po.
Thank you, Doc Leabres. For the interest of time, we'll just we'll just forgo with the Q&A portion. No, thank you, Doc Leabres, for spending this afternoon with us, and thank you for sharing your expertise sa buong QualiMed network. Hopefully, yung mga listeners natin and viewers ay may natutunan po, no? So basically, ignorance of the law is not an excuse sa mga ganitong bagay. So malaking bagay ito sa buong network. So, Miss Bambi.
Yes, thank you. Thank you, Doc Aaron. Thank you, Dr. Bien. Very interesting lecture, Doc. Very educational, I think, for all of us, if not only for our employees as well, but also these are very nice information for us to take with us for our families and our friends, no, para alam namin what to detect, what to look for. Kung medyo naiisip namin na meron na silang pinagdadaanan. But thank you for also sharing with us your email, so maybe we can reach you if we have some other questions, Doctor. No, so again, so thank you very much, Dr. Leabres, for being with us this afternoon for that very extensive lecture on drug-free workplace and alcohol-free workplace. So and also thank you to Dr. Aaron for helping us, no, in the facilitation of this session. So before we close lang po, we would like to extend our certificate of appreciation to Dr. Jose Bienvenido M. Leabres for his expertise and valuable role as a speaker during the webinar entitled Drug-Free, Alcohol-Free Workplace, given the 7th day of April 2022 via Zoom virtual event, signed Attorney Normala S. Vanguardia, OIC Vice President for HR, Ms. Margaret A. Bengzon, Group Chief Operating Officer, and Mr. Jaime E. Ismael, President and Chief Executive Officer. So again, Dr. Bien, we will just send this over to you. And also another certificate of appreciation to Dr. Aaron Christian Earl I. Villoso for his expertise and valuable role as moderator during the webinar entitled Drug-Free, Alcohol-Free Workplace, given the 7th day of April 2022 via Zoom virtual event. Signed, Attorney Normala Vanguardia, Ms. Margaret A. Bengzon, and Mr. Jaime E. Ismael. So maraming salamat po, Doctor. Thank you very much. So to close this session, ladies and gentlemen, I'm sure sana marami nga talaga tayong natutunan and na-pick up from this lecture. To close this afternoon session, may I call on our Vice President for Human Resources, Attorney Nimu Vanguardia.
Thank you, Ms. Bambi. Good afternoon, everyone. First and foremost, I would like to thank our very able speaker this afternoon, Dr. Bien, for the very comprehensive and engaging talk on substance use disorder. Thank you also to our VP PSQMOs beside me right now, headed by Dr. Gina Nazareth, for helping us organize today's talk, and to our HR and marketing teams, as well as to Dr. Aaron Villoso, our moderator for today. I hope that today's talk has opened our minds to the ill effects of any substance use and have somewhat helped us have the firm resolve to avoid any of these substances or even mere trying, no, even out of curiosity, under all circumstances. In the workplace, please realize that we all have a mutual obligation to keep each other safe. We rely on each other to stay safe. Let us keep this afternoon's learnings always handy, especially when we end up in situations of being tempted to even try. So let's continue to keep QualiMed, all our facilities, drug-free, alcohol-free, or any substance free. So thank you very much, everyone, and I hope you all learned a lot this afternoon and have a restful evening. Thank you.
Thank you very much, attorney. Thank you, Dr. Gina. Thank you very much. Mag-ano pala ka, very close friends si Dr. Bien. So thank you. But for the rest of you guys, remember this is an OSH webinar series for 2022. Session 1 we did last week. Today is our session 2. Please take note of the 3 following sessions. Please take a photo of this slide so you are able already to know and to please block off your schedules. All at 4 p.m. on April 22, HIV, April 29, Hep B in the workplace, and May 5, mental health issues in the workplace. Again, with that, ladies and gentlemen, if you have questions, just please siguro send it over na lang to your HR. And we hope, Dr. Leabres, if it's okay, if there are questions, if we can just post that to you. So again, ladies and gentlemen, maraming salamat. Have a safe trip home and see you next time. Thank you. Bye, guys. Thanks, doctors.
Thank you. Thank you, everyone.